As I talk now, we don't have Ebola in the country. The one who's been taking care is improving and has tested negative. And soon, once she gains strength, we will be able to discharge her. So our aim, our objective of all these measures is to interrupt the transmission, especially the high-risk districts at the border. The Government of Uganda, through the National Task Force, chaired by the Vice President, we want to communicate further measures as follows. The government is going to intensify mask risk awareness and sensitization on infection prevention and control, and observation of the mass gathering SOPs issued by the Ministry of Health for the entire country. This we are going to be using radios, TV, social media, and all institutions that are at our disposal, like cultural institutions, religious institutions, and all local government structures. Number 2, we are going to enhance screening. We've been doing that from the time we reported the epidemic, but we are going to double the screening, testing, and also we are going to enhance treatment capacities along the DRC borderline, and we are going to continue carry out the risk assessment, and based on that we will establish additional testing center to shorten the turnaround time for those that will be suspected. Number 3, we are temporarily suspending all cultural celebrations, commemorations that attract big numbers of participants along DRC-Uganda border. We are temporarily suspending the public passenger services on ferries, on Semliki River, the cross-border bus transport, and all public transport between DRC and Uganda for 4 weeks. But this, with the exception of goods and food and any other cargo that is being transported across the border. We shall be able to reconvene and continue assess the risk, and we guide accordingly. Number 5, we want to encourage the public to continue reporting any deaths, and therefore we are enhancing death reporting in all districts, but we are more emphasizing the districts that in those high risks, the one we categorized as high risk districts, especially along Uganda DRC border, not forgetting Kampala metropolitan area. We are suspending all flights to and from DRC to Uganda, and this takes effect within 48 hours. We are going to enhance border security patrols along the porous borders to minimize unnecessary cross-border movements. We have suspended all weekly markets in the border sub-counties of the high-risk districts for the next 40 weeks as we continue to assess the risk of Ebola transmission in our neighborhood. We encourage and we continue to call upon everybody, not only in the high-risk districts, but all of us, to enforce standard operating procedures in non-weekly markets in all border districts along DRC, including schools, prisons, hotels, and places of worship. We shall continue to facilitate only essential movements of population across borders for people originating from DRC, limiting it to only gazetted and designated crossing points. Number 11, we know that schools are going to open, and we shall open on time. School opening will not postpone, but we advise the head teachers and the Ministry of Education to ensure that all the SOPs we have issued are followed to the dot. The Ministry will continue to provide timely updates as the situation keeps on evolving.